it going, everyone? Welcome to another video of FitFully Yours. I am Dr. Khushboo here, and first of all, I want to thank you for giving such a positive feedback for my previous video. Your encouragement means a lot to me, and I'm really glad to hear that some of y'all are regularly following my exercises and actually getting the benefits. So today, I'm here to remind you of what precautions need to be taken against COVID. Yes, precautions. As you all know, many of y'all have started going to offices and the risk of getting the virus has increased even more. When the lockdown had just started on 23rd March, the amount of precautions that we were taking at that time with so few number of cases in India was a lot. But now, with such a tremendous rise in the number of cases, we are becoming even more and more lax about the precautions that we are taking. We always hear that if one member of the family is infected, then the entire family gets infected. So I am here to tell you what all precautions you can take at a personal level to avoid yourself and your entire family from getting infected. So, the 3 golden rules that need to be followed. Rule number 1, wearing a mask. Rule number 2, hand hygiene. And rule number 3, social distancing. After 4 to 5 months of coronavirus entering our country, wearing a mask should feel like a part of your body. I see many people, their masks don't fit their face properly, so they keep using their hands to adjust their mask on the face, and they end up touching the outside surface of the mask. So, wear a mask which fits your face properly. It should be not too loose or not too tight. It should cover your nose properly. It should cover the side part of your jaw and the lower part of the jaw. If you are wearing a cloth scarf, that's okay, but make sure that when you are removing it and wearing it again, you are wearing the correct side of the scarf on the outside and the inside of the scarf on the inside, and not vice versa. Second is hand hygiene. Carry a small bottle of sanitizer in your pocket at all times. When outside, if you feel that you have touched a public surface, then immediately sanitize your hands. Be obsessive compulsive about your hand hygiene. But when you are at home, don't use a sanitizer. Instead, keep washing your hands regularly. Follow the correct hand washing procedure at all times. Third and most important point is social distancing. Now that a lot of shops have opened up, try not to go every day for your shopping. Limit your shopping to once in a week or 10 days. Plan accordingly. I have seen a lot of people meeting their friends on Sundays and standing in groups and talking. And also, since a few festivals have been coming up, they are visiting each other's homes, close family and relatives. Please avoid doing that. If you're meeting your friends, meet in a group of 2 or 3 and make sure that the wearing of mask and social distancing is being followed. If you're visiting at a relative's place, make sure that you're standing at least 3 feet apart from each other, and especially staying away from elders. Even when eating in your shop or at your office, do not sit with your colleagues while eating and talking. Because even though you're wearing your mask at all times throughout the day, while lunch is when the mouth droplets are exchanged and the risk of infection increases more. If you think that your friends or colleagues next to you are not following the rules correctly, then correct them about the same. Now, if your work involves you going outside to your office or to your shop, then what precautions do you need to take after coming back home? First of all, wash your hands immediately after coming home and have a bath. Second, when you're sitting for lunch or dinner with your family, sit at least 3 feet apart. COVID spreads through mouth droplets. So, studies have shown that these mouth droplets can spread up to 3 feet when you're talking. So try to limit your conversations if you cannot sit more than 3 feet apart. After this, the most vulnerable age group are babies and individuals above the age of 55. If you have babies in your house, then make sure that you disinfect your house regularly and sanitize or wash your hands before touching your baby. If you have elderly in your house and if they are independent, then if possible, try to stay in a separate room from them. And if they are dependent and they need your help or care, then make sure to wear a mask and wash your hands while taking care of them. In conclusion, I would like to say that when you are outside the house, treat every person next to you as if they are a carrier of the virus or as if they are having COVID-19, and take all the precautions accordingly. Maintain social distancing from everyone outside. When you come back home, that time, assume that you are a carrier of COVID-19 or you are infected with COVID-19 and take precautions according to that. First, take care of your family members and then take care of yourself. Also, this video is again for those people who have already been infected with COVID-19 and have recovered from that, but you have not got an immunity passport. There is no research yet published saying that you can get a reinfection or not. So you have to still take the required precautions. We now have to learn how to live with the virus in our life and make changes accordingly. Finally, eat healthy food, stay safe and stay healthy. If you like my video, subscribe to my channel and share it with your family and friends. Thank you.